Now, hey everybody, this is Dr. Jess and Paul Burgess again with another podcast on solving the health puzzle, why you're sick, the real reasons. Paul, how you doing?
I'm good, mate. Always good to see you. You know what it's like. Same old, just trying to help.
I know. In the past few podcasts, we talked a lot about the real basis of illness being your attitude, what goes on in your head, how you feel, and
Yeah, I think there's a lot of value to knowing that your beliefs behind your behaviors drive some of the problems. So again, classic example that I keep using is if you believe it's okay to stay up till 2 a.m. watching Netflix, then that's what your behavior is. If you believe you should be in bed by 10 because that makes you feel energized and creative and productive, then you'll go to bed at 10. So it's very much what your belief system is drives the first part of what will eventually end up being symptoms, either good or bad.
it's interesting because as you were saying this in the past few podcasts, I did a little looking around, and even back to Hans Selye in 1936, where they noticed that people who were had bad attitudes or were depressed got more colds and things like that. They started the process of psychoimmunology. Also, there's some common wisdom that ulcers are not a result of what you eat; it's what's eating you. Okay, so I have a patient that I want to tell a story which I think will bring a lot of this together. And she's a 70-year-old woman who has metastatic breast cancer, metastasis to the bones and to the lungs. And when I was brought in on the case in November, end of October, November, she had, I called her up one day and she was so scattered on the phone that I got very frightened and started the process of getting her uh, some medical help, and she ended up in an ICU on a ventilator. And we thought, oh well, this is the end for this lady. But my groups in my church started praying for her. Some people were using a microcurrent unit called Healy to broadcast healing energy at her. And lo and behold, the next day she's off the ventilator. She's still very sick, but she's off the ventilator. I personally visited her about a week or so later when she was discharged from the hospital. And from her normal 125 pounds, she was about 180 pounds of fluid.
Mm.
She couldn't breathe. She was on oxygen. She needed 24/7 help. And the impression I got from her professionals who were visiting, like the visiting nurses, was, you're here to die. We're not going to be too surprised if you pass away. So I asked her, what are your intentions here? Because whenever I treat a patient with cancer, I want to know what their intentions are, because some of the stuff I do is pretty controversial. And she said, I want to live. I'm not, she didn't say I want to. She says, I'm going to live. And I tilted my head. I said, you want to live? She said, no, I'm going to live. I said, okay. So I brought my microscope with me, and I, did my thing, started on some foundational work. And that includes things like fixing her gut, fixing her cells. And she started urinating like crazy. And went to see her the next week. She had lost 15 pounds of water weight. By and by, her clinical condition improved dramatically. So within the space of 2 months, 2.5 months, she's back down at around 125 pounds. She's off the oxygen. She's able to walk up and down stairs, sleep in her own bed. And frankly, I felt pretty good about myself,
Yeah,
you
and so
know,
you should.
but you know, I think God kicked me in the butt and said, I said, well, okay. Let me ask. I said, I have to ask a question, because that I would love to say that all the patients I have in that stead have results like this, but as you know, that can be pretty variable. So I asked her. I said, what else have you done because this is pretty amazing. And I'm going to tell you that we got some lab work on it just to show you that this is no lie. Her cancer markers, which let's say we're in the 300s, and normally it's less than 30, the two of them, and I'm paraphrasing for for privacy purposes, had all gone back down to within the normal limits. She wasn't in pain, so they even had a tube inside of her chest to help drain the fluid that was in between the lungs and the pleura. They took that out. They were like, oh, "You're a miracle." As a matter of fact, that's kind of how we named her. Her last name is McMiracle now, instead of her true last name. And we had a nice discussion. And here's what it took to recover from this horrendous disease that should be her demise. She spent her entire day in meditation or prayer or listening to positive, inspirational things, following various gurus that, if I named them, you would know them, all in the let me get into a healing space in my head. I don't want to live, I'm going to live. And yes, I did a lot of things that were esoteric. I used microcurrent units. I used, different patches with her and everything I could think of that was healing. But again, I use this stuff a lot, and I don't get the same results everywhere. I mean, I get good results, no doubt, but this was pretty amazing. So I said something else was involved.
Well, I mean, we know that the way we think about things, we can bring upon ourselves all sorts of benefit or ill health, right? We know that, and
Absolutely.
and having a positive attitude towards healing, along with the intervention that you were doing, is kind of the biggest part of a missing puzzle most people negate, because
It's a commitment.
generally, well, this is what I find anyway. If I pay someone to wash my car, I don't need to do anything.
Right.
Right? If I pay someone to build the extension on my house, I don't need to do anything. But if you pay someone to fix your health, you still need to be involved. You still
Right.
got to take part. And they have the attitude that I've paid you, fix me. And
Right.
so all I need to do is take those supplements. Is it? Great. That's what I'll do then. And they miss this whole other part, which is why during our years worth of work that we do with people, the majority of it is based around coaching them on beliefs and their behaviors and how we can get them to start to really enjoy life and be
Right.
positive about it, because we know happy people tend to be healthier. So with that example you've got there, it's about you doing your thing, but her really engaging and being present and part of it as well. And in a combination, it's a very powerful thing. 70 plus years old, a
Right.
lot of people tend to check out at that kind of time, and she's not ready yet. So it's a
True.
it's, it's a great thing to watch, right? But what I'm interested in from that is, firstly, had she had chemo and stuff beforehand? Had
Yes.
she been treated?
Usually the stuff any kind of alternative intervention, they even, if you go to some of these clinics, they say, well, if you've had chemo and radiation, we don't want you because none of what we're going to do works. She had a mastectomy, she had chemo, she had radiation treatments, and I believe that there was metastasis to the brain, which is why I got
Yeah.
very frightened at first. But she was going to live. She said, "I'm going to live."
Yeah.
Went back into her, developed the happiness attitude, and her goals were not only it wasn't to defeat the cancer. She wanted to be able to take a walk and drive her car, and do her activities of daily living, and service her clientele because she was a healthcare provider herself. And I said to myself, those are and those are laudable goals. She did the work. She worked with me. I had to do a lot of correction with her because sometimes us healthcare providers are not the best people in the world. Like I said, like I always say, a doctor who treats himself or herself has got a fool for a patient. But I'll have to tell you, last week she took her first drive,
Yeah.
and she had been walking. And I'm impressed because not only clinically, but physiologically, looking at her lab work, I'm like,
Yeah.
this isn't just mental attitude. This
The,
actually changed and normalized the physiology.
100%. There's a few studies. There's some research I know I've read in the past where there have been people who are schizophrenic, and in certain personalities, they are diabetic. And when they're in that personality, their physiology changes to be diabetic.
Diabetes, right?
And when they come back out of it into another personality, it's no longer biologically the case.
It's in that extreme multiple personality disorder.
Yeah. And there's also times where people under hypnosis, whatever you want to call it, have been told that a piece of ice is a red hot poker, and it's touched their skin and their skin blisters on the
Right.
as it's a burn, and it's not actually a burn, it's ice.
Right.
But your body reacts to those things. It's massively powerful. The only thing that is an issue is that the ability to access that part of your brain that allows you to influence your biology is extraordinarily difficult. You know, it's not something that we pick up quickly, or it's not like
No, it is not
a
something.
12 video YouTube course that you can
Right.
watch to do it. It's something really intrinsic that you have to have. And that's where, and I know slightly off topic, but that's where a lot of these seminars where make $1 million, you make yourself a millionaire, every morning get up and say these affirmations. That stuff does not work because you have to believe it without
And you have to live it.
question, and it has to be you. That belief has to be you. And the trouble is, when you're reading it, you're not believing it. You're reading it with the mindset that I have to read this to bring this about.
Right.
And it's all third party. It's not, a part of you. And so getting that, it's hugely powerful from a healing perspective. And if we can get the patient to do that, as well as some of the really clever stuff that we do, you're going to get
Well, that is exactly true, because I can give somebody what their body needs to work, but ultimately their spirit, their insides, their mind, is the driver. And you can take that stuff, can be taken and discarded. It can be taken and utilized, or it can be taken and utilized the proper way. Often when we're consulting with people, I'll tell a story or give a picture. Now, because one of my favorite sayings is, you can understand everything right down to the quantum level, but you can only intervene at the global level. So it's really nice to be able to jump down a rabbit hole of a genetic pathway and say, yeah, oh, great. But the problem is, you say that's the reason for my issues. It never is. It's always a multiple set of things, because we're a complex, dynamic being. We're made that way. And the best way to intervene is to back up, do things globally. And if I let you know how something works, generally speaking, you'll allow it to work. Everything that you take in, everything that you do will be geared to allowing the physiology to optimize. And when you do that and you believe it, and it's not a matter of having just faith or belief, but truly understanding in a global fashion, your body will work the way that it's supposed to.
Yeah.
And what this patient did was take that to an extreme. But look at the result. She had a not life-threatening, it was more than life-threatening. It was life-ending problem that was turned around by saying, I'm going to live, but not just saying that, but doing the work. And it didn't happen overnight. This happened, granted, it was quicker than most, but it was since October, and it's now April. Okay. And she still has a way to go. But guess what? She's got to rebuild muscle now and stuff like that. Anything that is an illness requires the proper mental attitude and the participation or doing the work. Yeah. And usually, if it's a chronic illness, it always takes a while. 6-12 months is like next to nothing.
And I'd rather try and build back muscle than get my affairs in order. Do you know what I mean? I'd
Yeah,
rather be
yeah,
doing that than saying, right, I'm finished now. Let's contact Facebook and tell them, this is the person I want to run my account after I've died. That's
right.
not that's not a positive way of looking forward. What I'm interested also is, in that particular case, did you do any? Oh, it's probably a bit far down the line, but maybe now you could do it. Is trying to find out what was driving that cancer in the first place. Is there some sort of heavy metal, mold, toxicity kind of gig going on? Because I'll tell you why I say this, right? I had a patient come to me the other day talking about thyroid problems, and they were constantly trying to fix the thyroid. They're tweaking it, I need to find this, I need to get that measurement. What do I do for this? So
Right,
selenium,
right.
iodine, blah, blah, blah. And I'm like, hang on a minute. This problem you got going on here is being driven by these things down here. And you can tweak this all you like. As long as this is still going on, this is never going to work. But everyone looks at that, as well as a lot of practitioners, by the way. How do I improve your
Exactly. And that's the biggest problem.
right? How do I improve your T4 to T3 conversion, or
Exactly.
how do I get that working properly? And then they give you all of that stuff, the bile acids or the selenium or the iodine or whatever it is to try and get that to work. But there's this heavy metal problem going on down here that no one's addressed yet. And so that'll never work. And until you get right the way back down to all this kind of underlying stuff, that cancer or whatever drove it, because it is going to be like that. So it's just interesting to me whether or not you think in that process, because by the way, if she's doing well, who wants to rock the boat? But do you think
It's an intellect. I'll tell you this. You bring up a good point that we're going to do another podcast about. The problem with specialists. Okay. I've been around a long time. I've been a healthcare provider for 46 years now. Okay. And I watched the changes in the 1970s and 80s. And we went from the GP being king, in other words, being your advocate, being that doctor who came to your house, who knew your family and so forth, to everybody becoming a specialist. Now, in the before time, your doctor would send you to a specialist, and the specialist would barely talk to you, and then look at you and say, I'll speak with your doctor. Okay. And then you'd get a call from your doctor who would say either come in or talk to you on the phone, and they would tell you what the specialist said and then what their opinion was. And that's the way it should be, because the specialist, you're gonna understand this as I say it, they're great at what they do, but that's what they do. So if you go to a specialist in the thyroid, even if it's an alternative medicine specialist, the concentration is solely on the thyroid. And we're so much more than our thyroids. Okay. We are a complex, dynamic, interactive mechanism, biological mechanism that takes signaling from lots of different areas to perform any function. Specialists are very good at concentrating on a single area. The problem these days is that we don't have generalists. We don't have the GP. We don't have the person who will sit down and put it all together and be your advocate and take the responsibility of being your advocate, because the person who is the least able to diagnose a problem is the patient themselves. And that's who the responsibility is on now.
Yeah, absolutely. And I also think that a lot of practitioners or specialists, in inverted commas, like you say, look at that end result. But hyperthyroidism is not a disease.
No,
It
it's
is
an
a
end
symptom.
result.
Right. It's a symptom, right?
It's a downstream
and
effect.
People don't get it. They go, "Oh, you're hyperthyroid. Let's treat the hyperthyroidism. That's the disease. It's
right.
Autoimmune." No, that is a symptom of a load of other things that are going on, and it's never just one thing. It's always a combination of things.
Always is.
If it was just one thing, your body would deal with it.
Yeah.
But when it gets overloaded by a combination of things that all need to be addressed, that you get these symptoms. So
some of the discussions we need to have in the future, because we're running out of time, is why when I have seen so many specialists and so many great doctors, am I still ill? And one of the answers is the specialists themselves, because let's face it, if all you have is a hammer, everything looks like a nail. So although they're very good at dealing with that one thing, that doesn't mean that one thing is what's causing your problem, or just that one thing.
Maybe they're just wrong.
Yeah, that's
But
often what it
they've
is.
gone to specialize, and
Hmm.
they've just gone down the wrong path during their career and just got corralled down something they understood well,
Right.
but that forgot to realize there's some other things around that. I know we're going to move, but here's the last thing I'm going to say. I put a post up yesterday, actually. Even after cracking the human genome, we still couldn't cure cancer. Right? It's not a quick fix thing. It's
No,
not
it isn't.
we were all promised like these miracle cures. Once we've cracked the genome, we'll be able to change these things. No, even that, after multiple countries for many years collaborating together to break the biggest problem considered in modern day, we still don't have the cures for things. So it's not just about that end result thing, it's about the multiple things that are driving it. And until people start focusing on that rather than the hypothyroidism or the cancer, whatever, we're always going to fall down.
Just people remember this, okay? And if you leave with anything here that is usable, think about this. If you have a chronic illness or any illness really, or a loved one does, and you've been here, there, and everywhere, and you're not getting answers, what it is you need is a practitioner who will look at all the puzzle pieces, put them together, put all the facts together, look at everything, consider everything, look at the patterns of how you got sick, because that is the direction that is necessary to get you well. Focusing on single body parts or single body processes is almost never the answer. And you'll know that because you've been down that road, you've been down this road, and you've been with this practitioner, that practitioner, even those who claim that they look at everything, but really are specialists in certain areas. You need a generalist. You need a good generalist. And essentially, that's what Paul and I do. What we literally do is look at everything, put those pieces together, look at the patterns that got you ill, and that is a direction of getting you well. And we realize that it takes time, and you should realize that it takes time. There's no magical formula. The formula is very individualized, and you need somebody to walk that road with you, and that's where the coaching portion comes in. It's easy to give somebody a treatment plan and say, I'll see you in 3 months. That never works. There's so many branches to the road that you need to be counseled on contemporaneously, not 3 months hence. That's the type of practitioner who will allow you to heal, who you will work with, and you will have a life.
So what, mate?
Okay?
There's very few of us about. I promise you, very few about in the world, and that isn't being big-headed. That's a fact.
It is a
We've
fact.
developed this model. I certainly have developed it over the last few years.
Mm-hmm.
We have a training company that teaches other practitioners to do it, and they are hugely successful when they treat patients, as are we. But it has to be done in the right way through that model, and it's so hard to find someone like that. So
It's somebody who's willing to do the work. Okay,
yeah,
because no offense, people, but a lot of practitioners are plain old lazy. Okay, and it's easier to work within your little specialty than it is to take the time to broaden and train and train and train and get experience and train, because if
that's
you
why
don't
I've
know
got
what's
this.
wrong, you
That's why
won't
I've got
know
these
what to
lines
do.
here, Jess. That's
Oh
why I've
yeah,
got
well,
I'm always doing this.
you shave your head, man. I lost that honest.
I've got all these wrinkles from
Yeah,
where
I
I was.
know. I'm sorry, but I got to go.
No, mate.
It's a pleasure again, my friend. It's always a pleasure talking to you. Guys, we'll see you again in a little bit. Take care.
Take care. Bye.